Having an initial consultation will help determine which peel you're going to do. Some solutions that are lighter may be used for patients who have more sensitive skin or want to repeat the treatment more often. An esthetician can go over the different solutions with you and determine what your goals are. Patients who have maybe more texture issues or deeper wrinkles, more sun damage, they may be advised to do a peel that is a little bit deeper. The esthetician will help kind of guide you into what to expect with that treatment in your initial consultation at Maffi. Chemical peels take about 30 minutes to complete. You'd probably be in the office for about 45 minutes because that would include your prep time, cleansing the skin, and working through all of these layers. So I would plan on being here for about 45 minutes. Between each layer, we let the solution rest for about 3 to 5 minutes. And now that her skin has taken in about 2 different layers, we're going on to our 3rd layer here. And she's doing really well. You can see she's just getting maybe a little pink in the corners of her nasolabial folds here. She's tolerating it really well. Another thing that we would tell our patients after a chemical peel would be to avoid anything aggressive on their skin. You don't want to pick it, scratch it, pull it, or use any kind of cleansing cloth or electronic facial brush while your skin is in the peeling phase. You just want to let the skin exfoliate naturally. Much like a sunburn, it will start to flake within a couple days and continue flaking for another maybe 3 to 4 days after that initial peeling starts. We've got all of our layers applied to the skin. The peel solution stays on the skin. It has self-neutralized, which means it's no longer active, but it'll just stay on her skin until she washes her face tonight. We want to wait about 4 hours before we add any water to the skin. How did you think that felt?
Just a little tingly, a little bit warm, but actually it was quite relaxing.
Good. Depending on the peel, a moisturizer or sunscreen can be applied, but we want to just make sure that her skin feels comfortable and it doesn't have any more heat. After the peel, she would be advised to not work out for 24 to 48 hours. Depending on the peel, she may even want to wait about a week before she works out and adds any heat or sweat to her skin. I'd also advise her not to pick it, scratch it, or pull any loose pieces of skin that start to form in a couple days. Much like a sunburn, it needs about a week to go through a full cycle of renewal. So initially, she may just feel a little sunburned, so she can just apply a light moisturizer or just let her skin be. The depth of the peel is based on the pH level of the peel and the ingredients within the solution. The lighter chemical peels are going to target the epidermis and those top layers of dead skin. A medium to deep peel would target the next few layers within the skin, still promoting that cellular turnover and targeting the dead skin cell buildup, but it will also help improve fine lines and texture. Our patient today is going home with SkinCeuticals epidermal repair for her compromised post-peel skin, and then she can switch over to the B5 hydrating gel on about day 5 to 7, and both of these products will help give her skin hydration while her skin is healing. At Maffi, we like to personalize our treatment plans for our patients, so call our office and book a consultation with one of our licensed medical estheticians, and we can help design a skin plan that's right for you.